Hi, I am Dr. Arsalan and today we are going to discuss an inherited disease, the Erythroblastosis Fetalis. Erythroblastosis Fetalis is derived from two words, the erythroblastosis and fetalis. Erythroblastosis is the increased secretion of erythroblasts or increased secretion of erythroblasts. Erythroblasts are immature nucleated precursors of red blood cells. As the red blood cells are also called as erythrocytes, so their precursors or immature cells are called erythroblasts, and these are nucleated cells which are primarily synthesized and developed into erythrocytes. The word fetalis means the fetus. So the literal meaning of the word erythroblastosis fetalis means that the fetus secretes increased number of erythroblasts and immature RBCs into the blood circulation. Next is the discovery. The disease was discovered in 1932 by Diamond and his colleagues. Erythroblastosis fetalis can be defined as the disorder caused when the mother is Rh negative and fetus is Rh positive. And this Rh positive factor has been derived by the fetus from his father. So in this condition, the mother is Rh negative and fetus as well as the father, these are Rh positive. Genes of mother and father combine, it gives Rh positive to the fetus. Now the fetus is Rh positive in the womb of Rh negative mother. The problem arises here that the fetus has Rh positive blood group and the mother has Rh negative blood group. In some cases, the little amount of the blood, it reaches the mother's circulation, and when mother blood is exposed to this Rh positive antigen of the fetal blood circulation, the mother develops anti-Rh antibodies. So anti-Rh antibodies are produced in mother. This blood of the mother containing anti-Rh antibodies against the fetal circulation or fetus Rh positive blood group, when these cross the placenta and reach the fetal blood circulation, cause hemolysis of the RBCs or erythrocytes of the fetus. These anti-Rh antibodies, when these reach the fetal circulation, these cause hemolysis. Hemolysis means splitting of the blood cells or damage to the blood cells of RBCs or erythrocytes. These erythrocytes are destructed, fetus develop anemia, and this is also called as hemolytic anemia because the red blood cells have been destroyed and caused anemia. Usually the immune response of the mother is mild in first pregnancy because in this case the antibodies are developing, or this is the initial stage of the immune response. First fetus is usually normal, but the problem arises in the subsequent pregnancies or the second or third pregnancy in which the mother has already anti-Rh antibodies which can readily destroy the RBCs of the fetus, and in such pregnancies the erythroblastosis fetalis is fatal. Erythroblastosis fetalis is also called as Rh disease or mother fetal incompatibility. Because the mother and fetus, these are incompatible to each other, mother being Rh negative type and fetus is Rh positive type. This disorder is not present in the ABO blood group system, it's only present in the Rh type having D antigen. Now we will discuss the genetics of erythroblastosis fetalis or mother fetal incompatibility or Rh disease. As you know that in case of blood group system, antigen A is responsible for blood group A, antigen B is responsible for blood group B, and if these both antigens are present AB, so this constitutes the blood group AB, and if none of the antigen is present, this constitutes the blood group O. So this is called ABO blood group system. And if the antigen D is present, this is called positive blood group, or the heterozygous antigen of D, it also gives positive blood group because D is dominant and it is the antigen responsible for the blood group positive type. For example, if it is present with O, this will be O positive. If it is present with AB, this will constitute the AB positive, and similarly A positive or B positive. And if the antigen is homozygous recessive, this will constitute the blood group negative type like O negative, A negative, B negative or AB negative. So this is called as the Rh factor or D antigen is referred to as Rh factor. If D antigen is present, the blood group will be positive type, and if D antigen is not present, the Rh group will be negative type. We will take the case of Erythroblastosis Fetalis. In this type, if male is homozygous dominant or having D factor or Rh positive, and female is Rh negative having recessive D antigen, so in this case the offspring produced will be capital D with small d. So in this case the positive D type is present, so the offsprings will be Rh positive type. So 100% of the offsprings will be Rh positive. This was case number 1. And in case number 2, if father is heterozygous dominant type and mother is homozygous recessive type, so the father is Rh positive and mother is Rh negative. In first filial generation or F1, the capital D will combine with the small d, and the small d will combine with the small d of mother. So in this case 50% offspring will be Rh positive and 50% offspring will be Rh negative, because there is no D antigen in this case. So 50% offsprings will be Rh positive and 50% offspring will be Rh negative in this case. So if the father is heterozygous dominant, the 50% offspring will be Rh positive and 50% will be Rh negative. And if the father is homozygous dominant, then all of the offspring will be Rh positive type. The incidence of Erythroblastosis Fetalis will be maximum or 100%. Next is the risk factor. The major risk factor is when Rh negative female marries to the Rh positive male, the incidence of Erythroblastosis Fetalis increased. Next is the pathogenesis. As we know that the mother has produced anti-Rh antibodies against the fetus. When this blood of the mother reaches the fetal circulation, these antibodies cause destruction of erythrocytes of fetus or destruction of RBCs of fetus or hemolysis. The condition is called hemolysis, destruction of RBCs. The fetus develops anemia, and this is called hemolytic anemia because hemolysis has taken place and the fetus has developed hemolytic anemia. Consequently, the fetus releases erythroblast or the immature RBCs into the circulation. So therefore disease is called Erythroblastosis Fetalis because fetus has released immature RBCs into the blood circulation. Meanwhile, the pressure on the liver has been increased to produce more and more RBCs, so liver enlargement takes place. Liver is enlarged, and due to destruction of RBCs, the spleen also enlarges because spleen is the graveyard of RBCs. And all the destroyed RBCs reaches the spleen for further metabolism. In the spleen, this is called hepatomegaly or enlargement of liver, while spleen enlargement is called splenomegaly. So in case of Erythroblastosis Fetalis, two conditions develop, the hepatomegaly and splenomegaly. Moreover, the hemoglobin from RBCs, it is metabolized or changed into bilirubin. This bilirubin level in the blood increases called hyperbilirubinemia. Hyperbilirubinemia. This hyperbilirubinemia, this imparts yellow color to the skin. This hyperbilirubinemia or increased level of the bilirubin in the blood, it imparts yellow color to the skin, mucous membrane, conjunctiva, urine, feces and all the body tissues, and this yellowing condition is called jaundice. So the patient has developed hepatomegaly, splenomegaly, jaundice as well as hemolytic anemia. So these are the pathological consequences of Erythroblastosis Fetalis. Moreover, this hemolytic anemia, this is progressive and increases with the passage of time. So the case fatality rate is increased, and this is the fatal case in which the offspring or child may die. So the apparent clinical signs of the Erythroblastosis Fetalis or Rh disease will be jaundice and severe anemia. And in most of the cases, this fetus is killed out by the mother immune system, and abortion may occur or stillbirth may occur. So these two consequences are also present: the stillbirth in which died fetus has been aborted, or the abortion. Now we'll discuss the treatment of Erythroblastosis Fetalis. If it is known that the mother is Rh negative type and her husband has Rh positive type or positive antigen, so she may be administered with the injection Rhogam. Injection Rhogam is immunosuppressive injection. It is administered at 28th week of the pregnancy. 28th week means 7th month or start of 3rd trimester of pregnancy. Subsequently, when the fetus is born, the fetus is also administered at the time of birth, the same injection Rhogam. So the injection Rhogam is immunosuppressive and it decreases the effect of anti-Rh antibodies of the mother immune system. So this was all about the erythroblastosis fetalis. Thank you.